Thank you, Joan. And my direction that I received from Joan was to set the scene. Keep it simple, talk about the conceptual framework, especially if we are talking in the post-lunch session. Find out the gaps and identify the next steps. And I don't know how I'm going to do that in the next 10 minutes, but I'll try my best. And I think the first comment I would like to make here is that I don't know if you have ever seen a WHO publication or an author saying with a disclaimer that the viewpoints are of the author only and do not reflect the viewpoint of the organization. And in the area of early child development, I wanted to say is the mandate from our Director General, that the viewpoints represent the viewpoints of our Director General, about two important things that she wrote very recently in the last 1 year. One, on investing in early child development. And here we are talking about investing in early child development. Two, linking child survival and child development for health, equity, and sustainable development. And that's something that we have heard again and again. And I'm going to come back to this important platform later in our discussion. Nevertheless, it does mean that at WHO, we intend to work with member states and partners to ensure that every child has the best possible opportunity to realize its full development potential. That's one of the objectives, keeping in mind that we are working towards. And one of the issues that is important is the measurement and why assess early child development. And this is something our Director General Margaret Chan told us. You know, if you want me to advocate for early child development, if you want countries to do something, tell me how you can measure it, because what we measure gets done. If you are not measuring it, if you don't have a consensus around it, if you are not working together, this is never going to happen. So if we want ECD to be really high up in the agenda, we need to come up with a consistent, harmonized, concerted framework of action. Now, there are various purposes of measurement, and I think that's one of the important points that we have to keep in mind when we are thinking about the framework, that why we are doing it. And as Joan said, we are here focusing on population-based assessment. And one of the important issue here we want to measure is because to understand whether the children whose lives are being saved early fare well in their childhood development, to understand what services and support are being provided and are required. Basically in terms of understanding whether the development is on track and what is the coverage or the delivery of the various interventions. Now, what do we know and what are the gaps in thinking about the population level assessment? And the first point I would like to make here, and that has been made here earlier, is that ECD sits in different sectors. And so there is the whole area of health, nutrition, education, social protection, and child development is across all the sectors. So that's a boon as well as a bane, because it sits in all and it sits in none. So I think how do we bring all these sectors together from a different sectoral approach to an intersectoral approach to a trans-sectoral approach. And when I say trans-sectoral approach, I mean integration at the highest level possible to have a common funding across all the different sectors for ECD. And that's a key issue. The second issue is about the measurement and people looking at from the perspective of an individual child assessment, measurement for research in different programs, and to population level assessment. And we know about the different tools, and we heard in the morning about the different tools that exist. And the issue of the cross-cultural adaptability came out as an important challenge, and that we need to keep in mind when we are thinking about the assessment of early child development. The population level assessment of child development, lots of progress has been done. Claudia will be talking about mix later and the work that has been going on. We have the early development instrument and the reading and the math assessment by USAID. But one of the key gap here is that none for younger children less than 3. And if I was hearing the morning presentation correctly, early years are the key areas for investment, for delivery of services, for delivery of interventions. And it does make sense that we should have good measurement indicator for children less than 3. There is also a lot of work going in terms of the learning assessment frameworks, and I'm not going to go into the detail because I know Abby Rakes will be talking about the quality of learning environment and readiness to learn indicators immediately after my presentation. So we will hear about hear from her in terms of how the education sector is looking at early child development assessment. Then there are the policy tracking initiatives, and possibly Quinton might talk about it when he comes in here tomorrow, about the systems approach for better education results. And then there is also the monitoring quality of early childhood education and care from OECD. So there are lots of initiatives happening, but it does mean that there are fragmented efforts, and what we need to do, see how they can be harmonized and all the pieces fit together as a part of one puzzle. So to summarize the gaps, one is that it does not assess younger children or the continuum of development or provide holistic information on contextual factors. Simply, we can't implement ECD to scale without population level assessment. And as a key platform, especially for younger children, we need to link child survival and child development outcome assessment. I think it's an important message that we are hearing again and again, and that was reinforced today morning when Dr. Bhutta introduced the forum. And here I bring to your attention, and many of you know about the commitment to every woman, every child, and the different actions and activities that are undergoing in the area. Vaccines, the Global Action Plan for Newborn, the pneumonia, and other activities on the information gathering and accountability on the whole area around the women and the child. And it does make sense that it is not very difficult to create another rectangle and talk about child development as part of this information and accountability framework. Children who are surviving, we need to see how they are thriving, and we need to see how this can be integrated. And therefore, we organized a meeting, in fact, that was 1 month back in Geneva, where we looked at the monitoring framework for early child development at population level. Couple of points emerged, and one point being that when we are looking at the monitoring framework, it has to be a holistic. We need to think in terms of measurement of the contextual factors, and that's key. We need to think in terms of the inputs, the policies that exist. We need to think in terms of the outputs, the availability and the coverage of the early child development intervention and services, and we need to assess how the children are doing, assessing the child development as well as the child disability. So there has been a lot of progress done in terms of identifying psychological constructs, tools, and tool and item analysis, developing a measurement framework, and this resulted in the meeting that I just alluded to. The second point that emerged in that meeting is that when we are thinking about the framework, we have to think in terms of the different factors that influence early child development and measure each of them. So for example, measure the health factors, measure the education-related factors, measure nutrition-related factors, measure maternal factors, and home and family environment factors. Good news is some of this is already being measured, and it is part of the accountability framework. Many of you are familiar with these country profiles and the charts that are available. It's a crowded slide, and I'm not going to go into the details, but there are a lot of child health and the other environmental indicators, as well as nutrition indicators, maternal indicators that are being monitored. And these were some of the relevant child survival and nutrition indicators that are actually relevant to early child development, and these are part of Countdown to 2015. Indicators like stunting, prevalence, exclusive breastfeeding, antenatal care, indicators, treatment of childhood illnesses, indicators related to nutrition, for example, complementary feeding, drinking water and sanitation, women with low BMI, low birth weight incidence, and wasting prevalence. The education indicators are also being monitored. And if we are thinking about the additional area indicators that are actually not part of the current accountability framework, a few emerged. And these are some of the contextual indicators, violence against children. And when we talk about violence against children, it's a broad concept, violence within the household and violence outside the household. And violence within the household includes the concept of child maltreatment, the concept of abuse, the concept of which can be physical abuse, which can be psychological abuse or sexual abuse, and also the concept of neglect. And what we need to think about the whole concept of measurement of how the child is being treated within the home environment as well as outside home environment. The other contextual factor that emerged as an important aspect is the mental health of mothers and or the women of or the caregivers who are taking care of that child, because their health actually impacts on the caregiving practices, and these are important. We heard in terms of interventions, the child stimulation and caregiving as two key interventions. And so there is a linkage between the maternal mental health and the coverage of interventions like child stimulation and learning and caregiving practices. The third important fact that we heard during our meeting is that when we are thinking about measuring the impact or the outcome indicator, think about age-appropriate development, how the children are doing, is the development on track, but also think in terms of children with disability. And I think Maureen made a very good case in terms of why these two things need to be considered as part of one spectrum rather than two independent or parallel streams of work. So if we see the space of accountability framework, and if we think in terms of key indicator areas, there is some space available on the side, and what we need to see is how, as one voice, we can think about the different indicators and how they can be integrated and how they can be measured. There is still a lot to do in terms of that, and I focus here on especially on the earliest years. 0 to 3 we know is important, but what is the earliest age at which we can identify a valid and credible indicator that shows if the child development is on track? An indicator that helps us to raise political attention and priority setting? Is it possible that we can think in terms of development on track indicator from age 2? Because if we leave, also the other fact is that if we leave until age 2, there are a large number of children which are not included in the impact indicator monitoring, and we know that action is required early in life. And possibly for these children, maybe a risk factor or a coverage indicator or stunting as a proxy indicator may be the way to go. So these are some of the discussion points that we have been thinking about and seeing how do we move the agenda forward. And this requires review of constructs and items through existing data sets and looking at the proposals and protocols for field testing and validation. So clearly there is a lot of work that needs to be done in this respect. So this is my last slide, and I would sum up that as what are we thinking in terms of population-based assessment. So the what here is in terms of the need for holistic assessment of early child development. Holistic assessment means looking at the contextual factors, looking at the input factors, looking at the coverage factors, and looking at the impact factors. So not ignoring one aspect versus other. And who are the children across the spectrum, 0 to 8 we talked about, but we did understand that there is a gap in assessment framework for 0 to 3 years, and the further research priorities should focus on how well we can measure the early child development for these younger age group, and how is the platform approach and the importance of these delivery platforms, and that came up in the last panel. Integrating child survival and child development is a key platform for 0 to 3 years. There are other platforms for other ages, like the platform for education. But thinking about 0 to 3, child survival and child development integration does seem like the way to go. And process-wise, I think we do need to think in terms of harmonized, concerted efforts if we want to make a difference. And forums like this, as well as other opportunities, provide us to see how we can move forward together, and how in a couple of years we can see that we are monitoring the children's development and to see whether the countries are doing well or not in that respect. Thank you very much.
While we're waiting for Abby, are any clarifying questions? I'm going to break order here a little bit. One, otherwise I'm just going to move it right on to Abby. So we heard mostly about the 0 to 3, we're going to move up. All of this, of course, is related to both learning and healthy development, I want to just make a caution there that we're not separating these age groups and thinking health in one area and education in another, because it's continuous. Abby, are you with us?
Yes, I am. Can you
Okay,
hear me?
great. This is very ethereal, so go ahead.